Media, is everybody set with sound? Good afternoon. I'm Alicia Rohan, Director of Public Relations for the University of Alabama at Birmingham. Thank you for coming to hear about today's big news. We know some of you followed the University of Alabama System Board of Trustees meeting this morning, but we want to give you the opportunity to hear from our leaders directly. This afternoon, you will hear from Ray Watts and Dawn Bugera. Ray Watts serves as president of the University of Alabama at Birmingham and chair of the UAB Health System Board. Dawn Bugera serves as CEO of the UAB Health System and CEO of the Ascension St. Vincent's Alliance. As you can imagine, they are very busy this afternoon. So thank you both for being here and addressing the media. Out of respect for your time, let's jump right in with details we are able to share at this point. President Watts?
Well, good afternoon, everyone. It's a real pleasure to be with you, and it's an honor to serve our community as president of the University of Alabama at Birmingham and as chair of the board of the UAB Health System, especially on days like today when our commitment to our community and improving lives is on full display. Thank you all for joining us for this historic and exciting day. For all of us, Ascension, UAB, Birmingham, Central Alabama, and beyond. Today, the University of Alabama System Board of Trustees unanimously approved an agreement with Ascension, reached through very thorough study and due diligence. Under this agreement, the UAB Health System Authority will assume ownership of Ascension St. Vincent's Health System in Central Alabama to sustain patients' access to the highest quality care in Birmingham and surrounding communities. Under this agreement, the UAB Health System Authority will assume ownership of all Ascension St. Vincent sites of care, including hospitals in Birmingham, Blount, Chilton, East, and St. Clair, as well as the 119 campus, the trustful freestanding emergency department, and imaging centers and ambulatory clinics that are part of the Ascension Medical Group. The transaction will include current Ascension St. Vincent services, facilities, caregivers, and associates, including a robust network of excellent healthcare providers serving the region. This is an exciting opportunity to combine and optimize our collective strengths. We will be stronger for our patients and our communities and our employees, associates, and caregivers all working together. At a time when hospitals are closing across the nation, the UAB Health System has made it a priority to strengthen Alabama hospitals, support care providers, and increase community outreach and service through innovative partnerships that improve the state's healthcare ecosystem. UAB Health System represents a statewide network of integrated care and delivery of the highest quality care that's patient-centered, sustainable, and focused on the people who we serve. Because of that, we're best positioned to extend opportunities to St. Vincent's patients to access a larger network in the future while they maintain the services and providers they know and trust. In a moment, I will introduce Dawn Bugera, CEO of the UAB Health System and CEO of the UAB St. Vincent's Alliance, to share more details. But first, I want to recognize and thank a lot of people, many people who've been working hard for months behind the scenes on an agreement that is best for our patients, our community, and UAB and Ascension teams. And we look forward to working together with each of them, arms locked. I specifically want to thank our colleagues at the University of Alabama System office, particularly Interim Chancellor Sid Trant and UA System Board of Trustees for their unwavering support and guidance. I also want to thank the elected officials across the state who support our mission to improve the health of everyone in Alabama and beyond. It's been a pleasure to work with new communities and leaders across our state with that shared commitment. At this time, I'd like to ask CEO of the health system, Bugera, to come up.
Thank you, President Watts, for your leadership and support. And I, too, would like to thank the University of Alabama System Office, Interim Chancellor Sid Trent, and the University of Alabama System Board of Trustees. This is a great day for the state of Alabama. Since 1898, Ascension St. Vincent's caregivers and associates have served our community well. St. Vincent's is highly ranked with U.S. News and World Report, with Newsweek, and received honors including Women's Choice Awards and awards for environmental stewardship, patient safety, ethical billing, and other areas. We are excited to honor and to continue the St. Vincent's culture and legacy, and I look forward to seeing our talented, mission-focused teams combine their efforts for an even greater positive impact on our community. The UAB Ascension St. Vincent's Alliance launched in 2020 to increase Alabamians' access to high-quality, innovative medical care and help patients receive the right care at the right time and place. As part of the Alliance and our shared commitment to our patients, our caregivers, our associates, and our community, we have continued to discuss options to better deliver on our collective missions in an increasingly complex healthcare environment. It became clear that a deeper affiliation between Ascension St. Vincent's and the UAB Health System would ensure that the community has sustainable, quality healthcare access long into the future. We've seen through the Alliance the sincere, mission-driven commitment to serve our community that Ascension St. Vincent's and the UAB Health System share, and that shared purpose will drive our actions in the coming months and beyond. This deeper alignment with Ascension St. Vincent strengthens our collective abilities to improve the health of all Alabamians. Before I continue, I would be remiss if I didn't take a moment to thank the patients of Ascension St. Vincent's and UAB. You are the reason we exist. Thank you for putting your trust in these great organizations and allowing us to serve you. Today's news will not disrupt your care. On the contrary, I hope it demonstrates to you as patients that we are willing to do the difficult and innovative things to make sure you maintain access to world-class care that you deserve and have come to expect. Like President Watts said, the St. Vincent's patients will continue to have access to the healthcare services and providers they've come to trust, and will also gain access to a larger care network of local services. In addition to our commitment to our patients, we want to reiterate our commitment to our employees, our caregivers, and our associates. UAB Health System is recognized among the nation's best for innovative, world-class, people-first care, as well as among the best places to work in healthcare. We are an Alabama-operated health system that loves, understands, and meets the needs of our local communities. The local caregivers and associates at St. Vincent's are the same. We deeply respect their similar mission, community, and people-focused commitment, and we consider it our duty and our honor to make sure the St. Vincent's team feels secure and appreciated in this transition and beyond, and as we continue to serve our communities together. We will work collaboratively with Ascension St. Vincent's team to ensure a smooth transition in the short term, and we will continue to enhance the overall patient and employee experience in the long term. The transaction is expected to be completed later this year, subject to standard regulatory approvals, pending satisfaction of closing conditions, and approval by the Catholic Church. Until that time, the UAB Health System and the Ascension St. Vincent's teams will continue normal operations while our teams collaborate to plan a smooth transition. At this time, let me share some big picture operational plans, details of which we can share with you at this time. It's important to know that Ascension St. Vincent's caregivers and associates' job security is not threatened by today's news. We look forward to supporting continued operations of community physician practices and providing opportunities for Ascension St. Vincent's caregivers and associates to essentially remain in their current positions without having to reapply for their jobs. We are hopeful that most, if not all, of the roughly 5,000 caregivers and associates will remain in their roles. Employee compensation and benefits are anticipated to be comparable to those currently provided. We also look forward to embracing the existing clinical leadership and culture of care delivery at St. Vincent's. Like Ascension St. Vincent's, the UAB Health System plans to operate the St. Vincent's facilities as community hospitals with open medical staffs. Plans are for no changes to admitting privileges or day-to-day clinical operations, and no disruption of the existing clinical support staff model. Existing St. Vincent's medical staff bylaws will remain. And this is important. UAB will make new and increased financial investments into clinical and other important infrastructure. Also, UAB plans to use a co-branded model to current St. Vincent's locations and operations to honor and embrace the St. Vincent's people and culture. We look forward to sharing details as we develop them. Hopefully these details help give you an idea of what the transition looks like. Of course, there are some details that we don't know yet and that we'll be working on in the coming months. I look forward to communicating additional details of the transaction as they are determined. Most importantly, both entities are committed to working and communicating diligently with patients, employees, caregivers, associates, and our community. We exist to improve lives. And again, that purpose will drive our actions in the coming months and beyond. Thank you.
Thank you all again for coming. Obviously, between the extensive remarks provided today, the board resolution, and the news release we've provided you, you have a lot of information for this announcement. If you have follow-up questions, please reach out to the UAB Office of Marketing and Communications. You can send inquiries to me, arohan@uab.edu, and we'll continue to coordinate with you. Thank you.